The pelvis consists of three primary bones: the ilium, ischium, and pubis, which together form the hip bone, also known as the os coxae. This term comes from Latin, where os means bone, and coxa refers to the hip. Therefore, os coxae literally translates to hip bone, reflecting its role in forming the sides of the pelvis and contributing to the structure of the hip region. The ilium is the largest and most superior part of the hip bone, contributing to the upper portion of the pelvis. Key features of the ilium include the iliac crest, which is the superior border of the ilium and can be palpated on the outer edge of the hip. It extends from the anterior superior iliac spine, ASIS, to the posterior superior iliac spine, PSIS. This crest serves as an attachment site for abdominal muscles and fascia. Below the ASIS is the anterior inferior iliac spine, AIIS, which provides an attachment point for the rectus femoris muscle. On the posterior side, the PSIS and the posterior inferior iliac spine, PIIS, serve as attachment sites for various ligaments. The iliac fossa is a large, smooth concave surface on the internal side of the ilium, which provides attachment for the iliacus muscle. The auricular surface, an ear-shaped rough surface on the posterior ilium, articulates with the sacrum to form the sacroiliac joint. The arcuate line is a smooth curved ridge on the internal surface that helps form the pelvic brim. The greater sciatic notch, a deep indentation below the PYIS, allows the passage of the sciatic nerve and other neurovascular structures. Lastly, the iliac tubercle, a small bump along the iliac crest, serves as an attachment site for the iliotibial tract. Moving on to the ischium, which forms the lower and posterior part of the hip bone. Key features include the ischial spine, a pointed projection located between the greater and lesser sciatic notches, serving as an attachment for the sacrospinous ligament. The ischial tuberosity, a large roughened area on the posterior ischium, supports body weight when sitting and provides attachment for the hamstring muscles. The lesser sciatic notch, a smaller indentation below the ischial spine, provides passage for the obturator internus muscle. The ischial ramus extends anteriorly to meet the inferior pubic ramus and contributes to the obturator foramen. The body of the ischium supports the upper body when sitting and forms part of the acetabulum. The pubis forms the anterior portion of the hip bone. It includes the pubic symphysis, a cartilaginous joint where the left and right pubic bones meet in the midline, providing slight movement and shock absorption. The pubic tubercle, a small projection on the superior border, serves as an attachment point for the inguinal ligament. The superior pubic ramus extends horizontally from the body of the pubis to the acetabulum, forming part of the pelvic brim and providing attachment for the pectineus muscle. The inferior pubic ramus extends downward from the body to meet the ischial ramus and contributes to the obturator foramen. The pectineal line on the superior pubic ramus serves as an attachment site for the pectineus muscle. The pubic crest, the thickened superior border, extends from the pubic symphysis to the pubic tubercle, providing attachment for abdominal muscles. The body of the pubis contributes to the formation of the pubic symphysis and provides attachment for the gracilis muscle. The sacrum, a triangular bone at the base of the spine, is formed by the fusion of 5 sacral vertebrae. Key features include the sacral promontory, the anterior uppermost part of the sacrum, which marks the posterior boundary of the pelvic inlet. The alae, or wings, are lateral projections that articulate with the iliac bones to form the sacroiliac joints. The sacral canal runs through the center of the sacrum, containing the sacral nerves. The sacral foramina, openings on the sacrum surfaces, allow the passage of sacral nerves and blood vessels. The sacral hiatus, an opening at the lower end of the sacral canal, provides an exit for the filum terminale and sacral nerves.